Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, May 22nd, and this is my daily briefing. First off, I just want to let everyone know that I won't be posting a video on Monday, as Monday is Memorial Day, and we're going to take a 3-day weekend. And on that note, I also just want to say thank you to everyone out there who has served our country. So as of right now, we've still only had a total of 41 cases to date in Missoula County. 39 of those cases were identified by testing and 2 are epi-linked. We've had 40 recoveries and 1 death, and we have no cases in isolation, and we are no longer monitoring any close contacts. The state of Montana has had a total of 479 cases, which is unchanged since yesterday, and there have been 16 deaths statewide. First, I want to talk about antigen and antibody testing. We've been getting a lot of questions about whether we are offering the antigen or antibody test. These are 2 different types of tests, neither of which we offer. I want to take a moment to talk about the differences between these tests and why we're not using them. First, we need to talk about what an antigen is. So an antigen is something that triggers an immune response. It could be a toxin, pollen, or in the case of COVID-19, viral proteins or viral particles. These are different than antibodies, which I'll talk about in a moment. The antigen test uses a sample from a person's nasal passage that looks for proteins that are specific to the COVID-19 virus. This specificity is a potential strength of the antigen testing. These antigen tests are designed to find only what they're looking for and to find it quickly. This sounds great, but as you probably figured, there are some concerns. While antigen tests have the potential to find cases faster than a standard PCR test, they also have the possibility of missing cases as well. As I mentioned, antigen tests have high specificity, which means that when the test is positive, you can be really confident that the result means that the person actually has COVID-19 and that their symptoms are not due to something else. However, these tests are not as sensitive as other types of tests, which means that they might miss finding cases of COVID-19, and that is a problem. A negative antigen test may not mean that the person does not have COVID, which could result in people not getting correctly diagnosed, isolated, and then connected with public health for contact investigation or contact tracing. Why is missing a few cases a big deal, and what does this mean? Scott Gottlieb, the former FDA commissioner, said that the antigen test that recently received emergency use authorization has an 85% sensitivity. This means that if 100 people with COVID get tested, it would misdiagnose 15 of those people. You could easily end up with community spread if these people are not isolated. That's why an antigen test should only really be used as a first-line screening tool for symptomatic individuals in consultation with a medical provider. That way, if the antigen test is negative, the provider can follow up with a more accurate PCR test. This is also why we cannot use this antigen test to screen asymptomatic individuals. You would have to follow up with every negative with a PCR test, resulting in a lot of duplication that you wouldn't have symptoms to guide follow-up testing decisions. This test also hasn't been approved. Currently, there is one antigen test with an emergency use authorization. As I've discussed in previous briefings, an emergency use authorization does not mean that the test is accurate or has been FDA approved. So now let's switch gears and talk about antibody testing. Antibodies are proteins that your body developed in response to an exposure. Very simply put, antibodies are in response to antigens. Antibodies signal that you have had the disease but cannot be used to diagnose an active infection. Remember that antibodies, since they're formed in response to an infection, may not be detectable for days or even sometimes weeks after infection. Like the antigen tests, the accuracy of these tests is also in question. However, with antibody tests, a big concern is their specificity, or whether a positive test is indicative of COVID-19 antibodies, or if the test is reacting to similar proteins from other coronaviruses. This, again, is an important point, as a positive test could give someone a false sense of security. Just recently, the FDA rescinded emergency use authorization on several antibody tests and continues to tighten down on the tests that are out there. Also, we're still trying to figure out how to interpret what a true positive antibody test even means. We don't know if a positive result means that someone is really protected or for how long that protection might last. So what's the take home from all of this? There are several tests out there. The antigen test and PCR test are used to detect active infections, but antigen tests may lack the sensitivity that we need. This let me try that again. This test needs further study and review by the FDA, but hopefully the test can be used as a first-line screening tool for those who have symptoms. The antibody test cannot be used to detect active infection, only indicate that someone may have had COVID-19 in the past. But again, the reliability of this test and interpretation of the result really demands further study and review. So the last thing I want to talk about is face coverings. We've had community members ask us to remind people about face coverings in public. The health board did issue a strong recommendation that encourages people to cover their nose and mouth when out shopping or in public spaces where 6-foot distancing is not easily maintained. We're at a great point, and continuing good prevention efforts can really keep us at 0 cases, and we really don't want to lose what we've already gained. We've also had community members tell us that they don't believe that they are at risk and that they don't need to wear face coverings. Again, this is not about your individual risk, but about other people. Wearing a face covering doesn't mean that you're afraid. It means that you care enough about the people around you who may be at a higher risk for complications to be a good citizen. So that's it for my daily briefing today. Again, I just want to remind you that I won't be posting a video on Monday, as we're going to take a 3-day weekend for Memorial Day. You can subscribe to me on YouTube under my name, Cindy Farr. That's CINDYFARR. Click that little notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can call 258-INFO or 406-258-4636 if you would like to schedule a test if you're having any symptoms of COVID-19, or if you just have general questions about COVID-19 or have questions about resources that may be available to you. You can also call that number if you're concerned about the flooding that's occurring in Missoula County right now. They are answering questions about flooding there as well. You can also check out our website at missoula.co/cvirus. And that's all I have for you today. So everybody stay healthy and have a great Memorial Day weekend.